In early July, a 14-year-old boy in Malappuram consumed a hog plum fruit locally known as ambasanga, following which he developed fever and was later admitted to a private hospital by his parents. But as his condition worsened, his relatives shifted him to a government hospital in Kozhikode. However, despite intensive medical care, on the 21st of July, the teenager died from a massive cardiac arrest. According to the Pune-based National Institute of Virology, the teenager was confirmed to be positive for the Nipah virus infection. But what does this mean? Does this mean that another deadly viral outbreak is at stake here? This isn't the first time the Nipah virus outbreak has occurred in Kerala. Kerala's state government reported 4 separate outbreaks since the year 2018. A combined total of 17 lives were lost due to a Nipah virus outbreak in the eastern hilly region of Kozhikode and in Malappuram. But to clear things out, let me explain to you what the Nipah virus infection really is. It is a deadly zoonotic disease, that is a disease that is transferred from animals to humans, and it is caused by the Nipah virus agent, which is a highly pathogenic RNA virus belonging to the Paramyxoviridae family. What makes this viral infection a cause for concern is that it has the potential to spark another pandemic. There are no treatment modalities available to treat this infection, nor are there any vaccines to prevent this infection. The Nipah virus is harbored by large fruit bats of the Pteropus genus, which act as natural reservoir hosts. These bats are prominent during the months of December to May, but especially during the peak breeding periods of June and July. Intermediate hosts such as pigs, horses, sheep, goats, and dogs can also harbor the virus by acquiring it from these fruit bats. The Nipah virus can spread to humans through various pathways. Fruit bats can spread it to humans by contaminating fruits with their saliva or urine. They can also contaminate raw date palm sap, known as tari, with their saliva. Bats can infect intermediate hosts such as pigs, in which these pigs eat partially bat-eaten fruits and get infected. And later, respiratory secretions and urine from these infected pigs can infect humans. This sort of outbreak is not commonly seen now, but it was the first identified Nipah virus outbreak 25 years ago among pig farmers in Malaysia. But fruits contaminated by bats remain to be the major instigators for the viral outbreak among humans. In 2019, in Kochi, a person was confirmed to have the Nipah virus after eating a fruit bitten by a bat. In 2021, a boy ate a rambutan fruit and was later confirmed to have the Nipah virus. In 2023, 2 people died after being exposed to banana farms in a fruit bat prevalent area of Kozhikode. But once a human is infected, human-to-human transmission is much more common. An infected human that is coughing can release respiratory secretions and saliva that can infect other humans. The incubation period of the virus ranges from 5 days to up to 14 days, and in some extreme cases, up to 45 days. Therefore, early identification of infected people is essential to prevent further spread of the disease and treat the disease with higher chance of success. As of now, Kerala is strictly adhering to the Nipah viral outbreak protocol, in which appropriate triaging of patients is first done in any medical setting. Following this, fever patients report to the fever triage and are then sent to an isolation facility, where they are categorized based on their symptoms into 3 types of cases. Suspect Nipah cases are those who reside from an area or locality of the outbreak and have the following features: an acute fever with altered mental status or seizures, and/or severe headache or cough with shortness of breath. Probable Nipah cases are suspect case patients residing in the same area as confirmed or suspect Nipah cases during the outbreak period, or they may be suspect case patients who came into contact with the confirmed case patients. Confirmed Nipah cases are suspected cases with lab confirmation of the Nipah virus infection. They usually have a severe illness and a syndromic presentation of acute respiratory distress or encephalitis, that is inflammation of the brain, or myocarditis, that is inflammation of the heart. Laboratory investigations to confirm the suspected cases initially involve collection of bodily fluid samples through throat swabs, urine or blood collection of almost 5 ml, or CSF of 1 to 2 ml. These samples are then sent for real-time polymerase chain reaction testing, known as RT-PCR testing, to detect viral RNA. They can also be sent for ELISA testing to detect anti-Nipah viral IgM and IgG antibodies. Once the laboratory tests have confirmed positive for Nipah virus, intensive support care is continued for these patients, and standard care for encephalitis, myocarditis, and respiratory distress is given to patients with severe illness. But despite this, case fatality rate for these patients is almost 40 to 75%. Although there are no particular drug treatment options to treat this disease, the approved drugs include ribavirin, which is a nucleoside analog that broadly acts against several RNA and DNA viruses. It was first used in the Malaysia outbreak and later used in the Kerala outbreak of 2018, where it was given to 10 patients. Another approved drug includes the monoclonal antibody M102.4. This blocks the receptor binding site on the G envelope protein of the Nipah virus to prevent it from adhering to the FNB2 protein and therefore inhibits the entry of this virus into the host cell of the human. It was used in the Kerala outbreak of 2018 in Kozhikode.
Healthcare settings can implement standard infection control precautions to improve the efficiency and quality of screening tests so that they can detect early signs of Nipah infection to quarantine suspect cases at the earliest. Health education is another underrated practice which is quite often ignored. Healthcare providers, community volunteers, ASHA workers, and Anganwadi workers can all contribute to provide health education sessions to promote education about the Nipah virus to the general population. Mass media campaigns is another great way to spread awareness about Nipah infections. The No Nipah campaign by the Kerala government was a great initiative which helped spread awareness about this issue.
Although there are no vaccines available against the Nipah virus, the search for a vaccine has not yet ended. The National Institute of Allergy and Infectious Diseases have launched clinical trials on the novel mRNA-1215 experimental vaccine to evaluate its safety and effectiveness against the Nipah virus.
The healthcare system can enhance preparedness by practicing Nipah mock drills in hospitals of the Nipah affected regions so that doctors and other healthcare workers are well equipped to deal with the prevention of spread of infection. Enhancing surveillance by opening more outbreak monitoring units known as OMUs in tertiary care hospitals can help in early case detection and improved contact tracing methods. As of now in Kerala, with the help of contact tracing, almost 60 high-risk people have been categorized and are currently being tested for the virus. But the healthcare system should not be alone in this fight. We too can contribute to prevent the spread of infection. To prevent bat-to-human transmission, we can protect date palm sap and other fresh fruit products using protective coverings such as bamboo sap skirts. Freshly collected date palm juice should be boiled. Fruits should be washed and peeled thoroughly and properly. Fruits with signs of bat bites should be discarded immediately. To prevent animal to human transmission, we should wear gloves and protective clothing while handling sick animals during the slaughtering and culling procedures. Pig farms and pig feeds should be protected from the entry of bats. Human to human transmission can be prevented, especially during the announcement of a confirmed Nipah case, by regular hand washing and avoiding unprotected physical contact. By adhering to the standard Nipah control protocols and spreading awareness about the Nipah virus to the general population, Kerala will continue to effectively control the outbreak of Nipah.